Hi, this is Group 1. We have Bailey Wazak, Bonnie Moon, Bumi Aburishade, and Sam Chan, and we will be presenting on interprofessional healthcare teams.
Hi everyone, this is Bailey Walzak. In the next 2 slides, I'm going to be covering hallmarks and characteristics of interprofessional teams. First of all, we have positive leadership. This is leading by example, setting a good atmosphere for working environment, and making sure that the leadership is setting a good example for the rest of the staff members. Next, communication strategies. This could be conducting meetings where staff members can comment with their questions, concerns, and have open lines of communication. Next is rewards, training, and development, which goes into the next slide, which is resources and procedures. This is having policies and procedures in place and making sure that staff members have the appropriate training and are developing in their roles. As healthcare evolves, things change, and we want to make sure that all healthcare staff members are up to date in providing the best possible patient care. Next, we have appropriate skill mix. Each patient is going to require different disciplines in their healthcare team. So this means that we want to make sure that our patients who are on the ventilator have access to respiratory therapy, or our patients who have dermatology issues have access to dermatology or a referral place. So this is making sure that the patient receives the skills and the treatments that they need for the best positive outcome. Moving forward with hallmarks and characteristics of interprofessional teams, we have a supportive team climate. This means that you want to have a positive atmosphere. When things are going on that are negative within the healthcare team, things start to fall apart. Staff members start to not work so well together, and unfortunately the patients pay for this in a negative aspect, and it can become a hostile work environment for staff members as well if there's not just a positive atmosphere. Next, we have individual characteristics that support interdisciplinary teamwork. This applies to each individual. So this means that each individual needs to have a positive outlook on other members of the team. They hold a respect for the career that they have and the role that they play in the team, and they also have a respect for the other members of the healthcare team and what they bring to the table. Next, we have clarity of vision. So everybody needs to have an ultimate goal, and for nurses and other healthcare team members, our vision is to provide quality patient care. I mean, I know that's what a lot of us went into this work for, is be able to provide good quality care for our patients, and that goes into the next slide as well. So there's quality and outcomes of care. So we want to make sure that we are providing positive outcomes for our patients, and to do so, that means that we need to work well together as a team and form a compact team that works well together, is able to communicate, and has the same vision in mind. Next, we have respecting and understanding the roles. Like I had mentioned before, there are several different disciplines that go into the healthcare team, and each one serves a special role that is very important to making the team whole, whether you're the medical director or your housekeeping. Everybody serves a specific role in the healthcare team, and for everything to flow smoothly, each member needs to play their part, and everybody needs to value these individualized roles. Moving forward, we have purpose of interprofessional teams. So there's 2 main parts to this. The first one is improving the patient outcomes, and the next is benefiting the healthcare providers. So for the patients, we want to reduce preventable issues such as medication errors, treatment errors, misdiagnosis, medication interactions, and all of these things, these errors that we could potentially make, could lead to morbidity and mortality for the patient. So when we are reducing these preventable adverse reactions, we are ultimately decreasing the risk of morbidity or mortality. And next, we want to optimize the diagnosis, the plan, the treatment, And of course, patient education. So we want to make sure that everybody is on board with the correct diagnosis and plan. We also want to make sure that we are educating our patients about their diagnosis, make sure that they are confident in managing their illness or injury outside of the hospital or outside of the clinic, and that way we can reduce readmissions for the patients. Next, we want to benefit the healthcare provider. So we want to reduce extra work. We want to make sure that there's policies and procedures in place, that we have the correct number of staff members to safely take care of the patients and reduce staff member burnout. And as a result, we're going to enhance job satisfaction, and we're also going to improve staff morale, and we are going to help to reduce the staff turnover and ultimately provide a positive working environment for our healthcare providers.
Hi, this is Bumi Aborishade, and I will be presenting on successful team competencies. Some of the competencies possessed by successful teams include value and ethics. Team members need to understand the importance of respecting the unique cultures, values, roles, and responsibilities, as well as expertise of healthcare professionals. Developing a trusting relationship with patients, family members, and team members are very important, while demonstrating high standards of ethical conduct and quality of care in one's contribution to the team-based care. It is important to manage ethical dilemmas specific to patient or population-centered care situations. Acting with honesty and integrity in relationships with patients, families, and other team members, while maintaining competence in one's profession appropriate for the scope of practice. Next, we have understanding of the roles and responsibilities. This helps to set clear expectations. It is important for team members to understand how roles and responsibilities of other team members complement theirs in a patient-centered care or community population-oriented care. Communicate one's roles and responsibilities clearly to patients, families, and other professionals. It is important for team members to recognize their limitations in skills, knowledge, and ability, and while engaging diverse healthcare professionals who complement one's professional expertise. It is important to communicate with the team members to clarify each other's responsibilities in executing components of the treatment plan, while using unique and complementary abilities of all members of the team to optimize the patient care. Next, we have communication. It is important to avoid the use of professional jargons, as it helps to avoid miscommunication. The use of reports such as S-bars, call-out, and checkbacks ensures that the communication is well understood. It is important to organize and communicate information with patients, family, and healthcare teams in a form that is understandable while avoiding discipline-specific terminologies when possible. It is important to listen actively and encourage ideas and opinions of other team members, while giving timely, sensitive, instructive feedback to others about their performance on the team, responding respectfully to other team members to feedback from others. It is important to also use respectful language while communicating with in a difficult situation and conflict or crucial conversation. Next, we have team and teamwork, an essential component of patient-centered primary care practice is interprofessional teamwork. High-functioning teams require collaborations between different healthcare providers and non-healthcare providers. Also, working in teams involves sharing one's expertise and relinquishing some professional autonomy to work closely with others. And this includes patients, communities, families to achieve better outcomes. It is important that shared accountability, shared problem solving, shared decision making are characteristics of teamwork and working effectively in a team. It is important to develop consensus on ethical principles to guide all aspects of the patient care. Some of the barriers to effective team include power struggles among team members. This could lead to a toxic work environment. Also, lack of understanding of role clarity and lack of understanding about the roles and scope of practices of other healthcare providers could breed distrust as well as lack of respect. And this could in turn affect patient care, the quality of patient care. Also, negative stereotypes could affect the morals of team members, which, in the grand scheme of things, also affect the patient care.
Hello, my name is Sam Chan, and I am going to talk to you about the causes of conflict in our interprofessional team. The number one problem we faced was the lack of accountability. According to Brown et al., the cause of conflict with interprofessional teams involve role boundary issues, the scope of practice, and the accountability. The role boundary issues stem from the lack of understanding of each member's roles and responsibilities. Similarly, if the team does not understand each other member's scope of practice, that can also cause problems. When a problem occurs and no one in the team takes responsibility for it, it can further increase the tension between each member. And that is the lack of accountability. Accountability could be an area of improvement for all members in the teams. The second problem is direct communication. Poor communication can result in various adverse outcomes such as insufficient use of resources and poor work quality. Communication is a critical factor in interprofessional collaboration because each professional needs to communicate the plan or strategy from his or her perspective role. Important information such as deadlines and essential requirements need to be disseminated and understood by each member. The third problem we faced was the lack of technology skill. The change in the work environment of the 21st century have created new knowledge, skills, and ability requirements for workers. For example, ongoing development in technology are reshaping production processes and the task content and skill requirement of jobs. Most workers use a computer, the internet, or some other form of technology at work, and this number will continue to grow as the scope and sophistication of technology. Interprofessional teams need to be able to utilize technical skill to meet the demand of virtual collaboration such as Zoom meeting. The lack of technology skill creates obstacles for the team members and place a burden on the team member. The use of technology skill has become an integral component of work, education, communication, and entertainment. And in this slide, I'm going to talk about the conflict prevention. Number one, clearly define role and responsibility to prevent the lack of accountability that we discussed previously. Clearly define role and responsibility keep each member accountable for their workload and task. And number two, practice direct communication. Practice direct communication with each member to ensure objective and deadline are fully understood. Choosing the proper conflict resolution technique can help alleviate tension between team members and improve teamwork. Techniques such as open and direct communication, a willingness to find a solution, showing respect and humility have been shown to have a positive outcome in solving a conflict. Communication play a vital role in positive outcome. Clearly articulate the cause of conflict and acknowledge the problem from a different perspective help to solve the problem quicker. And number 3 is ask for help when encounter obstacle in a timely manner to prevent mistakes and delays in finishing the project. Research on how to perform a specific task, such as using YouTube or Google, can help a member overcome the obstacle in learning technology skills.
Next, I will be discussing conflict management by Bonnie Moon. Conflict can occur in interprofessional teams when not everyone agrees on how to do something. The most effective 5 methods of conflict management methods with interprofessional teams are avoidance, accommodation, collaboration, compromise, and competition. Avoidance is a conflict resolution for interprofessional teams to avoid any conflict by remaining silent. This is a frequently used method due to prioritizing patience, procrastination, over-optimism, beeper mania, and lack of time. Although constructive conflict can actually be a time saver. Another method would be to accommodate the desires of the team and give in to the team. Another method for conflict resolution is through collaboration, with all team members to discuss all sides of the issue and together come up with an agreement on a solution. This is the gold standard. When everyone does not agree, another solution is to compromise. When all these methods still do not work, there can be conflict resolution through competition. With competition, one member is a victor and the other is a loser and is seen in political conflicts. Team Strengths by Bonnie Moon. Next, I will be discussing our team strengths and substantiate our assessment. Our team strengths are collaboration, active interdependence, timeliness, unity of structure, favorable social climate, and a clear leader. In interprofessional healthcare teams, effective teams reach their goals. Overall, our team is very effective at reaching our goals to complete our group assignment collaboratively. We have all managed to do our assigned parts interdependently in time for completion before the due dates. There is unity of structure where there is not one person operating for the group as a whole. The work is divided fairly in our group. There is a favorable social climate in our group where everyone gets along and there is no conflict. Sam has volunteered to lead the team. He sets up our PowerPoint and is the first one to communicate our team goals and start the plan. Team Weaknesses by Bonnie Moon. Our team weaknesses are task effectiveness, efficiency, spending time on activities, agreement on set of process, and communication. In order to have an effective team that can learn from their mistakes, it is very important to talk about the team weaknesses. Overall, our team has more strengths than weaknesses, but there is always room for improvements to be made. Constructive criticism should be welcomed by all team members. Our group struggled a little with consistency of task effectiveness seen with all team members. Some members had different levels of efficiency where it appears some members may have spent a little more time on their individual portions than others. But overall, everyone did amazing work. We struggled a little bit with our first project on an agreement on a set of process. We learned through some scrambling at the end of the project that with better communication and planning, we will have a better flow of our work process and cohesiveness in the way we complete our individual portions. Our communication improved in the second project. At least I can say for myself, I was terrible at communicating and still need to work on it. I can get caught up in other tasks and forget to check my emails and forget to check in with the group. Our planning on our group process, although better the second project, needs improvement. Thank you for actively listening to our group project on interprofessional healthcare teams. Here are our references. Have a wonderful day.